got a slip disc, do I need to have surgery, or is there something else that I can do to help it? Now, there's a lot of different things to consider when you're talking about a slip disc, but if you sort of refine it down, what causes a slip disc? If you've had a specific car accident or a very, very extensive trauma to you yesterday and you've got a slip disc today as a result of that trauma, then chances are some surgery is more likely to be necessary. But the amount of people that have that particular issue that's caused their slip disc is very, very, very slim. We see most of our patients have some element of disc pathology in the neck or in the lower back. The overwhelming majority of slipped or bulging or herniated discs, in our experience, come from consistent back problems or neck problems that have built up over time. And in that case, there is something that is causing the disc bulge, and you need to understand that first. Simply going in and taking this sort of bulging disc and just chopping that off, you need to understand what's doing that first. And if you don't eliminate that problem, so you do that first and then do a treatment of some description, you're going to end up not responding well to whatever intervention it is, because you haven't understood what's caused the slip disc in the first place. Now, there are numerous options that don't involve doing surgery for slip discs, and they're substantially safer, and I'll run through a bit of those now. We do those in the clinic, but the main objective is to understand what causes a slip disc. Compression is literally the only thing that can cause a slip disc. The discs are like little water balloons. When they're nice and tall, or when there's a nice big space and not too much pressure going through them, they're nice and skinny. When you squash them, they get fat. It's very, very simple. It doesn't need a lot of explanation. That is it. So you need to take the pressure off the disc, and it causes a thinning or narrowing of the disc, i.e. the width of it. It's a compression that causes that disc bulge. So anything that's going to take the pressure off. Now, sometimes you need to understand the problem a little bit more as to how exactly you choose to do that. One of the treatments that we do here that works very, very well is spinal decompression. This is non-surgical, as opposed to surgical spinal decompression, which is used to refer to a variety of different surgical procedures that involve drilling bits of bone out, etc. Not that. The spinal decompression that we do here involves taking a strap around the waist and a strap around the thorax and gently stretching this disc to open out. It's generally a painless and in fact quite pleasant procedure to have done. It takes around about 12 to 15 minutes, sometimes a little bit longer, sometimes a little bit less, depending on the patient. And we combine that with some of the other therapies we have here, such as laser treatment, which works tremendously well in combination to actually get the disc to heal. And then using some of our other methods, we actually work on why is the disc bulging in the first place, why is the slip disc there, and then we look to actually address that, because otherwise you find that these problems just keep coming back and coming back and coming back and coming back, and there's no real lasting resolution for the problem. So that's really what I would suggest is a better approach than having surgery on a slip disc, because unless you're the extreme case of a one-off trauma, chances are there's lots of things that have led to that slip disc that need to be addressed before you even consider any sort of surgical intervention.